So we mentioned vitamin K in the introduction video about vitamins and minerals. So make sure to watch that video before watching this one. I will leave the link in the description box. So vitamin K is a fat-soluble vitamin, as we mentioned earlier, that comes in three forms: K1, K2, and K3. K1 is the phylloquinone. It's found in green leafy vegetables such as spinach, broccoli, cabbage, lettuce, vegetable oils, and dairy products. K2, which is the menaquinone, it is synthesized by the gut flora and fermented food, which means it's synthesized by the bacteria that is found in the gut. K3, it's the menadione, and it's a synthetic water-soluble form, and it's not longer used medically because of its ability to produce hemolytic anemia. So how do these vitamin K types differ from each other? As we mentioned earlier, they differ by the source, because vitamin K1 is mainly from the green leafy vegetables. However, vitamin K2 is mainly due to the bacteria in our intestines. And also, they differ by the action. Although both of them contribute to these actions, however, it was found that vitamin K1 is more involved in blood clotting and vitamin K2 is more involved in bone health and heart diseases prevention. However, as we mentioned, they both contribute to the same actions, but at different levels. Now, vitamin K role is to mainly help making various proteins that are needed for blood clotting and building of the bones. So the first use for vitamin K is blood clotting. As we know, blood clotting is very important to stop wounds from continuously bleeding. So we have something called prothrombin, and it is vitamin K dependent protein that is directly involved with blood clotting. Vitamin K helps to make 4 of the 13 proteins needed for blood clotting. So it stops the wounds from continuously bleeding so they can heal. People who are prescribed anticoagulants, which are also called blood thinners, and anticoagulants means they prevent the coagulation. Why do we need that? To prevent blood clots from forming in the heart, lung, or legs, and are often informed about vitamin K in these cases. Because of its blood clotting action, vitamin K has the potential to counteract the effects of blood thinning medications. A common method that estimates the blood levels of vitamin K is measuring the PT time. PT means the prothrombin time, and it is the time that takes for the blood to clot. People on anticoagulant medications such as warfarin or the Coumadin may be advised to eat a consistent amount of vitamin K from food and supplements to avoid a fluctuation in the vitamin K levels, which might reverse the action of warfarin, as its increased intake might decrease the efficacy of blood-thinning drugs such as warfarin or even blood-thinning vitamins such as vitamin E. And so, by that, vitamin K can be used to reverse the action of warfarin in case of warfarin overdose. Now, how is vitamin K involved in bone health? Vitamin K is involved with the production of proteins in the bone, including osteocalcin, which is needed to prevent the weakening of bones. Some studies have shown that higher vitamin K intakes are associated with a lower incidence of hip fractures and have been linked with low bone density. However, conflicting results whether vitamin K supplements reduce bone fractures. This may be due to the variety of other factors that affect bone health, including a lack of calcium, vitamin D, weight-bearing exercises, all of which might mask a benefit of vitamin K supplementation. And also, not only this, but also the blood clotting, the bleeding, it might not directly be associated with vitamin K deficiency itself, as there are many other factors that might be causing bleeding or affecting the bone health also. Now, how does vitamin K affect heart diseases? The image below outlines the vitamin K cycle. However, keeping it short and simple, we have coagulation factors, which are 2, 7, 9, and 10, as well as other GLA proteins, example protein C, protein S, protein Z. They help to prevent calcification or hardening of the heart arteries, which are a contributor to the atherosclerotic cardiovascular diseases, including multiple cardiovascular diseases. So these coagulation factors and proteins, they depend on the presence of vitamin K for their activity. So if we have vitamin K deficiency, we will be having abnormal elevated prothrombin levels, and thus prothrombin will be not doing its work, and it will not effectively participate in blood clot formation, which hence means more bleeding time. PT, which is the prothrombin levels, will be elevated. So what are the signs of vitamin K deficiency? Vitamin K deficiency in adult is rare, but may occur in people taking medication that block vitamin K metabolism, such as the prolonged use of antibiotics and other medications. The antibiotic medicines may destroy the vitamin K producing bacteria in the gut, and hence that will lead to vitamin K deficiency. Or in those with conditions that cause malabsorption of food and nutrients, and hence we have a problem in the absorption of the vitamins. So a deficiency is also possible in newborn infants, which is a very cautious condition, and I'm going to talk about later. The following are the most common signs of a deficiency: a longer time for blood to clot or a prolonged prothrombin time as measured in a physician's office, bleeding, hemorrhaging, osteopenia or osteoporosis, low bone mineral density and bone weakness. As we mentioned, it affects the bones. So because vitamin K is a fat-soluble vitamin, so it's best to eat vitamin K food with some fat to improve its absorption. So we can drizzle some olive oil or add diced avocado to your favorite leafy green salad. Now, what is VKDB and why does it affect newborns? VKDB is vitamin K deficiency bleeding in the newborn. It's a condition that occurs when the baby does not have enough vitamin K. Without enough vitamin K, babies have a chance of bleeding into their intestine and brain, which can lead to brain damage and even death. About half of all babies who develop VKDB bleed into their brains. Infants who do not receive the vitamin K shot at birth can develop VKDB up to 6 months of age. So discussing vitamin K shot with your doctor is very important. VKDB can be classified according to the time of presentation after birth. It can be classified into early, which happens within 0 to 24 hours, classical within 1 to 7 days, and late, it happens after 2 to 12 weeks. Early VKDB is very severe and is mainly found in infants whose mothers used certain medication during pregnancy that interfere with vitamin K metabolism, such as certain anticonvulsants or isoniazid or even the antibiotics. Infants who do not get the vitamin K shot at birth are at 81 times greater risk for developing VKDB than infants who do get the shot. So how can we prevent VKDB? The good news is that it is easily prevented. The easiest and most reliable way to give babies vitamin K is by a shot into a muscle in the leg. One shot given at birth will protect your baby from VKDB. The vitamin K given to neonates as a prophylactic agent is an aqueous colloidal solution of vitamin K1. Why babies are deficient in vitamin K and why does your baby need vitamin K shot? Babies have a very little vitamin K in their bodies at birth because of many reasons. Vitamin K from the mom is not easily shared with the developing baby during the pregnancy as it doesn't cross the placenta. What is the placenta? Placenta is an organ that develops in the uterus, covers the baby during pregnancy, and provides the baby with the oxygen and nutrients to the growing baby. It also removes waste product from the baby's blood. So the vitamin K doesn't cross this placenta and hence vitamin K will not be reaching the baby. The intestine of the newborn baby has very little bacteria, so they do not make enough vitamin K on their own. As we mentioned before, that vitamin K is produced by a bacteria that is found in our intestine. And so babies don't have enough bacteria and thus they will not be synthesizing this much of vitamin K. But does the baby get vitamin K from breast milk during lactation? Yes, but it's not enough to prevent VKTB. There is only a little vitamin K in breast milk. Breastfed babies are low in vitamin K for several weeks until they start eating regular foods, usually at 4 to 6 months, and until the normal intestinal bacteria start making vitamin K. What are the warning signs of VKTB in infants? In the majority of cases of VKDB, there are no warning signs at all before a life-threatening bleeding starts. However, babies who do not get a vitamin K shot at birth might develop any of these signs of VKDB, such as easy bruising, especially around the baby's head and face, bleeding from the nose or umbilical cord, pale skin, yellow eyes after the baby is 3 weeks old, blood in stool, black tarry stool, or vomiting blood, irritability, seizures, excessive sleepiness, or a lot of vomiting may all be signs of bleeding in the brain. That was all about vitamin K, and the next videos are going to be different vitamins.